Hello, my name is Dr. Micah. Welcome to the Ivf Series. In this video, we will be talking about what IVF truly is. And we'll delve a little bit into the factors that determine the type of IVF a couple will benefit from. Okay, stay with me. Let's go. Okay, what is IVF? IVF simply means in vitro fertilization. IVF is an umbrella name for a lot of procedures to help couple achieve pregnancy. You have been married for 1 year or 1 year, 6 months or thereabout. You've not missed your period, not once. You've not had any miscarriage or spontaneous abortion. Then you need to seek the help of a fertility physician. All right. IVF is involves a broad protocol, involves broad procedures, right? There are lots and types of them, which I would list here in this video. And then let's talk about what it involves. IVF simply means a woman who is struggling to have kids, or she starts menstruating, for example. Even before she starts menstruating, she's called in to do some tests where the doctor checks her ovulation, checks her follicles, checks her ovaries, checks the womb, and make sure everything is fine. Do what we call the serology screening, which involves checking for hepatitis B, HIV, hepatitis C, chlamydia, check her hormones like the AMH, prolactin, and the thyroid stimulating hormone. All of these is just to help prepare her to make sure that she is okay. And then on the husband's side, we do what we call the semen analysis. We check the hepatitis B, hepatitis C, HIV, and VDRL, as well as other necessary vitals. I need to check the sugar level as well before they are prepared for IVF. This is what IVF is. And then when she's on her menses, she's called in to take her eggs, and then the eggs are fertilized with the sperm. This is on the conditions where everything is normal with both couple or both spouse, right? And then on day 4, day 5, the eggs are transferred back into her womb to carry the children till 9 months. And then she delivers. All right. Now, this is what IVF means in its entirety. All right. So let's talk about the types of IVF. Now, there are 3 different broad groups of IVF. I would list them on this video. The first one is called the conventional type of IVF. Conventional type of IVF simply means where all situations are normal. This is the most common one, where a couple, the woman is stimulated to produce more mature eggs with the help of drugs. And then during her menses, day 5, day 6, day 7, as the case may be, depending on the development process, the eggs are collected when they are at about 18 to 20 millimeter in size. And then they are cultured. And then the sperm is put in a medium, and the sperm is also used now to fertilize them outside of the woman's womb. That's what the conventional IVF is. Now, we have, under this conventional IVF, we have what we call the IVF with own eggs. Conventional IVF with own eggs, meaning that the woman is younger, everything is going fine, our eggs are developing well. We use our own eggs, fertilize our eggs with the husband's sperm, and then the eggs are transferred back into her on day 4 or day 5 after collection and after fertilization. That's what we could now call the conventional IVF with donor eggs. This is used for clients, for lady of a couple when the lady is above 37 or above 40, as the case may be. Why do we do this? Because the tendency to have quality eggs at 40 years and above is kind of reduced depending on WHO standard. So we advise that we use egg donors who are younger, 22, 23, 24, collect their eggs, and then use it with our husband's sperm to use to fertilize the egg and transfer. That is what conventional IVF with donor eggs mean. Now, there's another type called conventional IVF with donor sperm. The couple, come in for IVF, the woman is stimulated, but her husband's sperm is having a lot of issues. Despite stimulating or augmenting it with a lot of drugs, it's not working. We get another man's sperm and then use to fertilize our own eggs, and then the fertilized embryos are transferred back into her. Then the last type of conventional IVF we'll talk about is the conventional IVF with donor egg and donor sperm. As a couple, because of difficulty with getting a quality sperm from the man, despite being placed on medication, difficulty with the woman getting stimulated to produce mature eggs, we use a donor egg and a donor sperm. But she carries the children for 9 months. All right. That's another type of IVF. The next set of IVF is called the natural set of IVF, the natural stimulation or minimal stimulation type of IVF. On this video, I've listed them here. The first one under this group is called the natural cycle IVF. In this natural cycle IVF, a couple comes in for IVF. There's no medication used in the woman. After these tests are done, she goes on her menses. Day 4, day 5, day 6, day 7. She comes in for scan regularly to check how the follicles are, how our eggs are developing. And then when the eggs are developed up to 17, 18, 19, 20 millimeters, they are harvested. And then we use the husband's sperm to fertilize it. The second one is called the minimal stimulation IVF, where the woman is placed on some medications. This medication will depend on what her hormone profile really says. If her hormone has some fluctuations and all of that, she will be placed on medications we call follicular stimulation medications to help our ovaries produce more mature and quality eggs. And then when these eggs are mature, they are collected, they are harvested from her. We do what we call egg harvesting. It is not a surgery. They just use the ultrasound scan to now use a egg needle to get these eggs out, and then the eggs are fertilized with our husband's sperm. There's another one we now call modified natural IVF, where the woman is placed on a lot of medications to stimulate our eggs to grow to a quality we want, and then we use our husband's sperm. And then the last set of IVF is what we call the advanced IVF. Advanced IVF is, the normal IVF plus ICSI. Conventional IVF plus ICSI. ICSI simply means intracytoplasmic sperm injection. This is a case where the wife is okay, we've collected the eggs and then we've placed it. We check the husband's sperm, but we're having difficulty with the husband's sperm. But he insists on using his own sperm. He does not want another man's sperm. We do what we call ICSI. We collect his sperm, wash it thoroughly, and then forcefully inject it into the eggs, or into the eggs that have been collected, the matured eggs, and then they are monitored, and then the process becomes more successful. Although advanced IVF with ICSI is expensive and costlier. All right, there's another type of advanced IVF we call the pre-implantation genetic diagnosis, PGD. Pre-implantation genetic diagnosis is for couples who probably have genetic problem in their family. For example, couple that have Down syndrome in the family from the father side or the mother side, or any of these genetic problems, and you don't want your children to have it. We could get the eggs and the sperm, fertilize them, and then before they are transferred into the woman's womb, we will do what we call genetic testing. Test these embryos whether they have any genetic problem, and this is only the best embryos that are transferred. This is why IVF stands a better option to conceive children, because it's only the best follicles, the best embryos rather, that are transferred into the woman to grow. The other type of IVF is called what we call the IVF plus surrogacy, right? IVF plus surrogacy, where the eggs and everything is done, is fertilized, but the woman is not in a position to carry children because of one problem with her womb or thereabout. Now, another younger lady is asked to carry these fertilized embryos for 9 months, as the case may be, and then at the end of that 9 months, the baby is given to the original couple to, as their legitimate child. Yes, that is also very, very possible. All right, that's another option of IVF. Now, let's talk about the factors that determine the type of IVF a couple will benefit from. I will list them here. One of those factors is age. Age of the woman is very important when it comes to IVF. While the man can be old or can be at any age and does not have any problem, the woman has to be of a certain age. If we're intending to take her own eggs, if we're intending for her to carry the children, she has to be of a certain age. WHO standard between a woman that is older than 37 or 40 is not wise to harvest her own eggs, because the quality of those eggs are diminished with age. All right. Now, another major determining factor is massive fibroid. Does the woman have fibroid? Now, the type of IVF, like we said, determine on whether this woman is able to carry the children to 9 months. For women that have massive fibroid, you need to go to the gynecologist to make sure these fibroids are treated or taken care of before you go for IVF. We know that IVF is not a 100% protocol or procedure. You don't want to now have issues on the line that will further cause it to fail. All right, another factor that can influence or that will cause a couple to know which particular IVF they can benefit from is what we call the previous history of previous pelvic surgeries. As a woman has fibroid surgery before, as a woman has cyst surgery before, where they do operation to remove a cyst. Another factor that can affect a couple to conceive is called the multiple D&C. For a woman that's had multiple abortions done and scraping of her womb, that can affect the quality of her womb to carry children. Another factor we'll talk about is called the sperm quality of the man. A man that has complete azoospermia, that does not have any living sperm, it's difficult to use such a sperm, and so we will need the service of a sperm donor. Another factor is the egg quality. These are some of the factors that can determine what option of IVF a couple will need. Once again, thank you. This is the IVF series. We'll drop more videos on this topic going forward. Please like, share, comment, and subscribe.